Hello everyone. Welcome to another episode of Neurovascular Intervention case series. It's a case of recurrent right MCS stroke who presented with recurrent weakness of the left side of the body. First episode was 3 years ago, and now again since last 2 weeks he is presenting with difficulty in elevating the right arm and mild difficulty in walking. Let us look into his MRI. MRI was showing an acute infarct in the right MCA territory and very old infarct with chaotic changes, and flare was also showing the same with very large gliotic area and new stroke. MR angiogram was showing faint flow in the right ICA. MR angiogram of neck failed to show the origin of right ICA, and the flow across the right ICA was very faint. And we proceeded with the DSA. In this DSA, we can see severely narrowed origin of the right ICA. So we planned for carotid angioplasty in this case. So in this difficult tight stenosis of right ICA, first we need to pass a microwire across the stenosis segment. With some effort, we could able to pass the micro catheter. Now we are dilating that narrowed stenotic part with a 1 millimeter coronary angioplasty balloon. So we were able to dilate the narrowed segment by carefully angioplasting this lesion with 1 millimeter balloon. So we were able to form a tract through which embolic protection and stent could be deployed later. So we removed the microwire, and now we are negotiating the embolic protection distal wire, and with some effort we were able to pass this embolic protection device wire, delivery wire, through this narrowed segment which is dilated with 1 millimeter balloon. So this required some manipulation, and we were finally able to cross the lesion and put this embolic protection device, which is a device which protects the brain from having stroke during this carotid artery stenting procedure. With this deployment of this device makes this procedure very safer, and this umbrella-like device you can see in between two dots. This is the embolic protection device. So now we have to take the stent across the lesion. Since the lesion is already dilated, with the same embolic protection delivery wire, we can take the stent. So now we are crossing the lesion. We are taking the carotid stent through the gate catheter through the same micro wire for this distal protection device. This is how we are delivering the stent. The stent is 8 into 7, 8 into 6, 30 millimeter carotid stent. So the carotid stent is being placed accurately across the narrowed stenotic right ICA stenosis. This accurate placement of stent is confirmed by using X-rays and also using dye injection during the placement of stent. So the stent is being deployed, and we can see it has covered the stenotic area very well, both proximally and distally. What is the next procedure? Now we have to do a postplasty. You can see that the stent is constructed in the middle part of the portion, and now we have to post angioplasty. So we are taking a 5 millimeter balloon across the narrowed segment through the same wire. So this is a 5 into 20 millimeter balloon which is being deployed across the same lumen. The balloon is coming. Yeah, this is a balloon which is through the constricted segment, and we are doing a very gentle angioplasty. So you can see the dilation of stent. Now the stent is well dilated, and we can see the flow to the intracranial circulation very well. Now we are waiting for 10 to 15 minutes. We are taking multiple shoots through the stent. We are seeing that the entire plaque is covered with the stent. We wait for 15 minutes, and after that we are taking a check shoot which shows there is no thrombosis and there is good flow across the stent to the intracranial circulation. Now we can remove the embolic protection device. So embolic protection resheathing sheath is coming across the same wire, and this is how we remove the embolic protection device. We are again confirming the good flow across the stent. So we can see that near total occlusion of the right ACA is completely healed with this carotid stenting. Patient tolerated the procedure well and is discharged after 48 hours of observation. Thank you.